Hello and welcome to Pregnancy Info. Here we will discuss the facts and the natural ways to reduce high blood pressure during pregnancy. High blood pressure during pregnancy carries potential risks. Here's what you need to know and how to take care of yourself and your baby. Having high blood pressure during pregnancy needs close monitoring. Here's what to know about the potential risk, also known how to take care of yourself and your baby. But what are the types of high blood pressure during pregnancy? Sometimes high blood pressure begins before pregnancy. In other cases, the condition develops during pregnancy. Number 1. Chronic hypertension. In chronic hypertension, high blood pressure develops either before pregnancy or during the first 20 weeks of pregnancy. Because high blood pressure usually doesn't have any symptom, it might be hard to know exactly when it began. Chronic hypertension with superimposed preeclampsia. This condition occurs when chronic hypertension leads to worsening high blood pressure during pregnancy. People with this condition may develop protein in the urine or other complications. Gestational hypertension. People with hypertension, called gestational hypertension, have high blood pressure that develops after 20 weeks of pregnancy. There is no excess protein in the urine and there are no other signs of organ damage, but in some cases gestational hypertension can eventually lead to preeclampsia. Preeclampsia. Preeclampsia occurs when hypertension develops after 20 weeks of pregnancy. Preeclampsia is associated with signs of damage to other organ systems, including the kidney, liver, blood, or brain. Untreated preeclampsia can lead to serious, even fatal complications for mother and baby. Why is blood pressure a problem during pregnancy? What are the causes and what are the after effects of this high blood pressure? Less blood flow to the placenta. If the placenta doesn't get enough blood, the fetus might receive less oxygen and fewer nutrients. This can lead to slow growth, low birth weight, or premature birth. Babies born early can have breathing problems, increased risk of infection, and other complications. Placental abruption. In this condition, a placenta separates from the inner wall of the uterus before delivery. Preeclampsia and high blood pressure increase the risk of placental abruption. Severe abruption can cause heavy bleeding, which can be life-threatening for you and your baby. Intrauterine growth restriction. High blood pressure might result in slowed or decreased fetal growth. Injury to other organs. Poorly controlled high blood pressure can result in injury to the brain, eyes, heart, lung, kidney, liver, and other major organs. In severe cases, it can be life-threatening. Premature delivery. Sometimes an early delivery is needed to prevent life-threatening complications from high blood pressure during pregnancy. Future cardiovascular disease. Having preeclampsia might increase the risk of future heart and blood vessel disease. The risk of future cardiovascular disease is higher if you have had preeclampsia more than once. It's also higher if you have had a premature birth due to having high blood pressure during pregnancy. How will I know if I develop high blood pressure during pregnancy? Monitoring your blood pressure is an important part of prenatal care. If you have chronic hypertension, your healthcare provider will consider these categories for blood pressure measurement. Number 1. Elevated blood pressure. Elevated blood pressure is a systolic pressure ranging from 120 to 129 mm of mercury and a diastolic blood pressure of 80 mmHg. Elevated blood pressure tends to get worse over time unless steps are taken to control it. Stage number 1. Hypertension. Stage 1 hypertension is a systolic pressure ranging from 130 to 139 mmHg or a diastolic pressure ranging from 80 to 89 mmHg. Stage 2 hypertension. This stage is more severe. It's a systolic pressure of 140 mmHg or higher or a diastolic pressure of 90 mmHg or higher. After 20 weeks of pregnancy, blood pressure that's higher than 140 by 90 mmHg without any other organ damage is considered to be gestational hypertension. Blood pressure needs to be taken and documented on 2 or more occasions at least 4 hours apart. What are the signs of preeclampsia? In addition to high blood pressure, the signs and symptoms of preeclampsia include extra protein in the urine or other signs of kidney problems, severe headache, changes in vision including temporary loss of vision, blurred vision or being sensitive to light, upper stomach pain usually under the ribs on the right side, nausea or vomiting, decreased level of platelets in the blood, impaired liver function, shortness of breath caused by fluid in the lung, sudden weight gain and swelling, particularly in the face and hands. It often occurs when preeclampsia. The swelling associated with preeclampsia is more severe than the typical swelling that happens during pregnancy. Now question is that, is it safe to have blood pressure medications during pregnancy? Some blood pressure medications are considered safe to use during pregnancy. However, angiotensin converting enzyme or ACE inhibitors, angiotensin II receptor blockers and renin inhibitors need to be avoided during pregnancy. Here are some natural ways that can help you to control your blood pressure naturally at home. But for that, you have to learn these tips one by one. Number 1. Manage stress. Stress is a driver of high blood pressure. When you are chronically stressed, your baby is also in stress and your body is in a constant fight or fight mode. On a physical level, that means a faster heart rate and constricted blood vessels. When you experience stress, you might also be more likely to engage in habits that can have negative effects on blood pressure, such as drinking alcohol and eating processed foods. Several studies have explored how reducing stress can help lower blood pressure. Here are 2 evidence-based tips to try. Number 1. Listen to soothing music. Calming music can help relax your nervous system. Research has shown that it's an effective component to other blood pressure therapies. Number 2. Work less. Working a lot and stressful work situations are both linked to high blood pressure. Number 2. Try to lose weight if necessary. In people who are overweight, losing weight can make a big difference to heart health. According to 2016 study, losing 5% of your body weight could significantly lower high blood pressure. The effect is even greater when weight loss is paired with exercise. Losing weight can help your blood vessels to go better job of expanding and contracting, making it easier for the left ventricle of your heart to pump blood. Drink less alcohol. Drinking alcohol can raise blood pressure and increase the risk of several chronic health conditions, including high blood pressure. While some research has suggested that low to moderate amounts of alcohol consumption may protect the heart, those benefits may be offset by negative effects. In the United States, moderate alcohol consumption is defined as no more than 1 drink per day for females and 2 drinks per day for males. If you drink more than that, it might be best to consider reducing your sodium intake. Salt intake is high around the world. This is largely due to increased consumption of processed and prepared foods. Many studies have linked high salt intake with blood pressure and heart events including stroke. However, the research indicates that the relationship between sodium and high blood pressure is less clear. One reason for this may be genetic difference in how people process sodium. About half of the people with high blood pressure and a quarter of people with typical levels seem to have a sensitivity to salt. Exercise. Exercise is one of the best things you can do to lower high blood pressure. Regular exercise helps make your heart stronger and more efficient at pumping blood, which lowers the pressure in your arteries. In fact, getting 150 minutes per week of moderate exercise such as walking or 75 minutes per week of vigorous exercise such as running can help lower blood pressure and improve heart health. Smoking. Among the many reasons to quit smoking is that the habit is a strong risk factor of heart disease. Every puff of cigarette smoke causes a slight temporary increase in blood pressure. The chemicals in tobacco are also known to damage blood vessels. However, studies haven't found a conclusive link between smoking and high blood pressure. This could be because people who smoke regularly develop a tolerance over time. Still, since both smoking and high blood pressure raise the risk of heart disease, quitting smoking can help lessen that risk. Eat healthy food. People with low calcium intake often have high blood pressure, while calcium supplements haven't been conclusively shown to lower blood pressure. Calcium-rich diets seem to be linked Healthy blood pressure level. For most adults, the calcium recommendation is 1000 milligrams per day. However, some people, including older adults, may need more. Other than calcium, magnesium is an important mineral that helps blood vessels relax. While magnesium deficiency is pretty rare, many people don't get enough magnesium in their diet. Along with that, you should have medications. The type of medicine included to treat hypertension depend on your overall health and how high blood pressure is. 2 or more blood pressure drugs often work better than one. It can take some time to find the medicine or combination of medicines that works best for you. When taking blood pressure medicines, it's important to know your goal of blood pressure level. You should aim for a blood pressure treatment goal of less than 130 by 80 mmHg. If take away. In the end, we will warn you that in the pregnancy, it is very dangerous for you and your baby. So apply all the changes in your lifestyle and take the food that is good for your heart health and avoid the things that reduce your efficiency of blood supply. Take care and bye-bye.